So can you give me your name, please, and your organisation and job title?
Yes, my name's Sheena Byram and I'm a freelance midwifery advisor.
And can you give me your name, please, and your organisation and...
My name's Shelley Shaw. I come from York Foundation Trust. I'm a labour ward coordinator and a clinical skills midwife. So this is my first contact with Baby Lifeline and the first conference that I've attended.
So can you tell me a little bit about the course today and what people are going to be getting out of it?
The course today really is focused on emergencies in the community, and it's basically for community midwives who are attending women who birth at home. So very useful because it's teaching and going through practical examples of when emergencies occur at home birth, for example.
And going back to work, what do you think you're going to be able to implement from what you've learned today on the course?
Well, clearly as a clinical skills midwife, I'm a responsibility for giving emergency drills and skills to community midwives and hospital midwives, and I feel that very often hospital midwives, there's a bigger emphasis on training hospital midwives in emergency skills and drills, and community midwives sometimes are left cold and dry with no input, and we don't always adapt the day when we're teaching and training emergency skills drills to community midwives. So for me today has been a first. I think for the first time we've really, for me personally, I've acknowledged that community midwives are very much on their own, isolated, meet emergency situations, and to tool them up to be able to deal with those efficiently and safely is just absolutely fantastic.
And can I ask you, what's your knowledge about Baby Lifeline and your experience of them? What do you think about Baby Lifeline?
I think Baby Lifeline is a fantastic charity because what it does is it supports midwives and healthcare professionals who are working in maternity services to ensure that mother and baby are safe. And in the times of limited resources within NHS trusts, we look to people like organisations like Baby Lifeline because they can give us that extra support. They can add value to what we already do in terms of training and provide days like today at a reasonable cost, and really have the experts who are in the field working, sort of midwives and paramedics who are working within the service coming in to deliver the training, which is always better. So for me it's been like a unity of a charity functioning alongside healthcare professionals to ensure the training is appropriate and adequate so that mothers and babies are safe.